Wait, hold on. There you go.
Good evening, everyone, and welcome to the Mental Health Power Hour series, a three-part Zoom session powered by the Omicron Sigma chapter of Phi Beta Sigma Fraternity Incorporated, the North Dallas Sigmas. My name is Damon Sells, and I am the Director of Social Action for the Omicron Sigma chapter. Once again, I'm thrilled that you're here joining us today, and shout out to those of you who tuned in for part one of our three-part series last week, where we discussed basic knowledge and signs of mental health. And tonight, we will present part two to the masses. This week, we will be discussing treatments and diagnosis. But before we go any further, I want to thank Phi Beta Sigma, the Omicron Sigma chapter, for this space and opportunity. I want to make sure that the Social Action Committee and the Communications and Technology Committees from Omicron Sigma get their flowers as well. I also want to thank the staffs at Seasons of Life Counseling, Strike Middle School, WellMed, and Optum. Additionally, I want to make sure that we show love to the ladies of Delta Sigma Theta Sorority Incorporated for their attendance. Now, we've got a lot of information on deck, and we've got two very, very qualified individuals who will lead us tonight as panelists. So first, let's introduce Rhonda Burks. Rhonda is a licensed professional counselor since 2016 and the founder of Seasons of Life Counseling. She's an advocate for student well-being who has 12 years experience working in education and 4 years as a school counselor. Rhonda has provided passionate counseling services specializing in trauma, anxiety, depression, and life transitions. She is committed to fostering resilience and promoting mental health awareness. And she's also a member of the Denton County Alumni chapter of Delta Sigma Theta Sorority Incorporated. So let's welcome Rhonda. Thank you for joining us. We look forward to your information. How you doing?
I'm great, thank you.
All right. And teaming with her tonight, her partner in red, so to speak, and someone who I have known for a long time.
Social
By
action.
long, I've known her since I would think 9 years old.
Yes,
Dade Haynes Elementary, Kirby Junior High School, Hershey High School, Wichita Falls, Texas, my hometown, her hometown. Allow me to introduce to you Dr. Tamika Perry. Dr. Perry has degrees from Prairie View A&M, the University of North Texas Science Center, and she also has earned her medical degree at Philadelphia College of Osteopathic Medicine in Philadelphia, Pennsylvania. Dr. Perry is a board certified representative in family medicine and by the American Osteopathic Board of Family Medicine, and she currently is an associate medical director for WellMed. She also sits on health equity and inclusion committees within Optum. Now, if that's not enough, Dr. Perry also has a radio show podcast called Docs in Pod, which is aired in Texas and Florida. And yes, she is also a member of Delta Sigma Theta Sorority Incorporated, an active member of the North Dallas Suburban Alumni Chapter. Dr. Tamika Perry, welcome. Good to see you, my classmate. And thank you for joining us. How you doing?
I'm doing great. And I was so excited when you asked about this because this is such an important topic, especially in our communities, right? Mental health has this taboo stigma that people just kind of don't want to talk about or don't want to recognize. But according to the Centers for Disease Control, 16.9% of the African American population self-reports having a diagnosis of depression, and almost equal numbers of anxiety. And with that said and done, Rhonda and I will talk about the dichotomy of treatments, pros and cons, how to recognize. I mean, Rhonda, what do you recognize first with depression? Some symptoms that you recognize.
So first of all, we want to make sure that individuals understand what depression actually is. And it's actually just a mood disorder that's characterized by persistent feelings of sadness. You may notice someone who's feeling hopeless. You may see changes in their sleep habits, or they may see changes in their sleep habits. Someone who typically don't drink or do drugs or gamble or have bad shopping habits may start to exhibit those characteristics. Those are all signs of depressions. And when you start to see those things in loved ones, you definitely want to, express concern and help them in seeking treatment for that.
And I think, Damon, the important thing she says that it's atypical of that person. Most certainly, some people are have clinical diagnosis as a little person, just like some people atypically have hypertension younger. And you have to say, well, why are these people more susceptible, or what makes them more susceptible? What is the fancy medical term is pathophysiology, right? So we have what I call these happy hormones in our brain. Those are dopamine, norepinephrine, epinephrine. And they allow us our mood to be even keel when they're at a certain level. When those levels are elevated, we feel elated or high. Rappers will say they get high on their own supply. And I know they mean something else, but literally when you do street drugs, your brain has increased levels of what you already make, your own supply of dopamine, epinephrine, norepinephrine. I mean, to put it in clinical context, that feeling you get, and I know this is a family show, but that feeling you get with an orgasm, or the feeling that you get when you go down a roller coaster that in the pit of your stomach, or when you hear a feel-good church sermon, that euphoric feeling you get, that's because there's a surge of dopamine, epinephrine, norepinephrine, serotonin, and then it's quickly broken down, right? Well, people who are clinically depressed have lower levels of these. So that's the physiology of it, and it causes us to react mentally and socially in a different manner, right? So that's depression. And then if we talk about anxiety, which is in another bucket, and the reason that Rhonda and I mention these two is because these are what's most common, what we see every day, right? So if we talk about anxiety is when we have an increase of that fight or flight response. And that is when there's increase of adrenaline that's released from your kidneys. And what the fight or flight response is that if you come in contact with a big bear, you either gonna fight, y'all like my hook, right? You gonna fight or you gonna flight. Either way, right, your pupils are going to dilate, your heart is going to palpate, blood is going to be diverted from your gut to your muscles because you're in that mode. And that big bear could be the bill collector, divorce. It could be, your teenage daughter told you she was pregnant, or your teenage son told you he had someone pregnant. But that is your big bear, and that causes that anxiety. And so Rhonda and I treat them together, two different pathways, but they complement each other. So Rhonda, some of the things that you do to help people with anxiety are like, give me some examples.
Well, first of all, provide psychotherapy for individuals. So being able to, and again, for those who are like, what is psychotherapy? It's nothing more than just talk therapy. So you're basically, sitting in with the therapist, and you're learning just different coping strategies in order to be able to kind of deal with anxiety and depression on a day-to-day basis. You're coming in and you're able to work with your therapist in order to be able to kind of identify and challenge those negative thought patterns that may come along with anxiety and depression, and just kind of help be able to kind of develop healthier ways of managing those emotions.
Yeah, so I was telling Rhonda earlier when we were preparing for this, y'all have to stop me at any time because I like to talk and I'll just take over. So y'all have to intervene. Like, Dr. Perry, fall back. It ain't your turn no more. So, but with that said and done, when people come into the office, and one of the things I screen them for, if they're coming for anxiety, depression, or if we recognize it, one of the things that we ask is, do you have a history of drug abuse in yourself? Does your family have a history of drug abuse? Because oftentimes people will self-medicate a mental diagnosis, whether it's depression, anxiety, bipolar disorder, which is a branch of almost depression plus a manic anxiety put together, whether it's PTSD. And yes, most certainly, like a lot of diagnoses, mental disorders run in families.
It's good stuff. It's good stuff. Let's talk culture and community for a quick second. And I want to hear your thoughts, both of your thoughts on this. How do cultural factors influence the expression and the overall treatment of mental health in different communities, particularly in the Black community?
Rhonda, you want to take it first? You want me to take it?
Well, first of all, I think that, well, you can go ahead, you go ahead and talk from your perspective first.
Well, from my perspective, when patients come in, a lot of times, the patient will come in and 95% of my patients are African American. Maybe 90% are African American. And the patient will be crying, sad, talking about how they don't feel like doing things that they normally do. And the medical term for that is anhedonia. And they'll disclose, well, the only reason I'm feeling like this is because, my partner just died. My kids moved out of the house. And I'm like, well, I think you maybe experience, depression. And I'm not saying depression has to last forever, because most certainly it goes into remission and you get better, then most certainly life circumstance will happen. I said, no, I'm not depressed, but you've cried the entire 20 minutes we've been talking. You told me how your appetite has changed. You told me how you used to not drink, but now you drink, wine on a daily and consistent basis. These are clinical signs of depression. And a lot of times we don't recognize this, especially in our community, because one, either we think it's a testament of our non-faith, right? I ain't got that, or because it's not a physical diagnosis where we have a blood test for, we can measure it with a machine, then it's not a real diagnosis. And that is most certainly not the case. And I think Rhonda and I both will attest to, once patients are actually treated for the entity, whether it's depression, anxiety, and they say, you know what, I guess I didn't even realize I was. I'm not sure why people a lot of times are a little hesitant for treatment of these disorders, because you don't really find people hesitant to be treated for their high blood pressure, or people hesitant to wear glasses because they can't see. But when it comes to anxiety and depression, they think I should be able to just shake it off. I should be able to just, and it doesn't quite work that way. I mean, Rhonda, what is your experience?
Well, I think specifically in the African American community, we're taught to just kind of, suck it up and deal with it. So it makes us reluctant to kind of seek the help that we need for treatment. And we don't really want to acknowledge the fact that we are struggling with depression or anxiety or any other mental disorder. So I think culturally it plays a significant factor in how we accept it, or how we kind of brush it under the rug.
So we won't submit any of this till.
We have so many.
Okay, so you say 15 to 30 days?
So many other issues going on, like socioeconomic issues, right? We as a people, we are worried about paying bills, worried about, taking care of family members. Lo and behold, how dare we be allowed to have anxiety or depression? But a lot of times these other issues are what's causing the anxiety and depression.
Perhaps the easiest question, and for what it's worth, in the 13 minutes that we've been on, I mean, we've received a ton of information, and I love that. Absolutely love that. Perhaps the easiest question that you both may get for the entire session: what is all involved when a diagnosis or check for mental health occurs? And this is probably more for the casual viewer who has no idea. I mean, is it an exam of sorts? Is it just a medical evaluation, a psychological evaluation, some sort of testing? What's all involved in that process?
So that answer is kind of multifactorial. This is where it's great to have a great relationship with a primary care provider like myself, or a great counselor like Rhonda, because that person is going to help you navigate that. But from a pen and paper standpoint, there's plenty of clinical tools that we use. One of those clinical tools is called the PHQ-9, the Patient Health Questionnaire number 9. And what it does is a list of 13 or 14 questions in which we go through, we ask the patient, and we rate their answers. And these answers are graded against people with known clinical depression. Most certainly we can measure serotonin, dopamine, epinephrine, norepinephrine levels, but in this day and age, it's not very efficient testing, and it's costly testing. It's almost like to say, I have a lot of patients who ask me, do I have the DNA for obesity? We can do those tests for you, but look at your mama, daddy, brothers, sisters, cousins. Now, if they's a little thick in the middle, you probably got it in your family. You know what I mean? So what we do is we answer those standardized questions and say, it is a likely diagnosis that this is what's going on with you.
Yeah, and I think it's really important to, like Tamika said, Dr. Perry said, it's really important when you're in front of your healthcare provider and they're asking you those assessments questions.
Rhonda, you want to mute?
Rhonda went to mute. Let's see if we can get her back.
Am I muted?
There we
Yes, you
go.
were.
Everything
I'm
that you
sorry
just
about
said
that.
30 seconds ago, run it back. I'm sure it was gold.
No, I was basically saying it's really important, like Dr. Perry said, when you're in front of your healthcare provider and they're asking you those assessment questions, that is, it's imperative that you be truthful in answering those questions, because if you're not, then you're not able to be referred out and get the help that you're needed. So if you're being truthful in your and answering those questions, then your doctor is able to identify the need that you may have and able to provide you with those resources to be able to get you the proper treatment.
And Loretta makes an excellent point. You know, I've had lots of patients because my staff will do the PHQ-9 first. And by the way, Medicare recommends that we do it, not recommends, it requires me being a Medicare provider. And I see all patients, but for this population, I have to do it at least once a year.
It is all
I
Sunday,
do it
losing the night.
on
Yeah.
all new patients. And the patient will say, no, I'm not. The second question on there is, do you feel down, depressed, sad, or hopeless? You know, several times a week, one time a week, almost every day. And they'll answer no to all the questions. I'm not tired, I'm not depressed, I don't have appetite issues. And when I go in the room, they're crying. And I'm like, what's the matter? And I said, but you said you weren't sad. I said, no, I just cry a lot. Okay. So it's super important to be forthcoming, because if it's hindering your activities of daily living, if it's hindering your normal lifestyle, it needs to be addressed.
So I'll ask this to both of you. For those who really are trying to help others out there, what's the best way for a friend or a family member worried about someone dealing with mental health issues, just to encourage them to seek help? You know, because let's be honest, there are people out there who don't want you to be in their business. They prefer that you are behind the wall of sorts, no matter how bad a shape that they're in. Let me get your thoughts on that.
So go ahead, Rhonda, go ahead.
Well, I was just going to say, from my perspective, I think, like you said, it can be challenging because a lot of times people don't want you in their business for whatever reason. But you can encourage them simply by just expressing your concern for them and for their well-being, and making sure that you're doing it in a non-judgmental way. And just letting them know that you're concerned about them and that you're here to support them through whatever it is that they're going through. Also, another way is just by listening and validating their feelings, because that creates a safe and supportive space for them to really be able to kind of open up and talk to you about whatever it is that they're dealing with. And if you are someone that you know have dealt with those same issues or mental health conditions that they may be having struggles with, share those experiences with them, because it helps them to feel like they're not alone in that journey.
I tell my patients all the time, I've been to counselors several times throughout my adult life, and there's nothing wrong with it. The first time I went, because y'all may be surprised, but I'm Black. Okay.
No.
So the first time I went, I had the same attitude as everyone else. A lot of people in my family that I know, like, what am I going to talk to somebody for? I'm paying them for what? And then after that first session, I'm like, oh, that's what that is. Okay, I understand now. So I understand. So it does help to, give your own anecdotal, this is what it's for. In addition, there's many somatic or bodily signs of depression that, overlap with other things like, sleep apnea, hypertension. So one of the things you might tell your loved one is, why don't you just go see your doctor and talk about X symptoms, your fatigue all the time, right? Because most certainly we do want the doctor to test them for thyroid disorder, because thyroid disorder, hypothyroidism, can precipitate depression. So it may be a true physiologic something that's causing that. So great place to start is always a healthcare provider, always. And even if it's the other way around, you went to LaRhonda first and LaRhonda said, listen, there may be something else going on here besides just run-of-the-mill depression or anxiety. Let me refer you to a physician. Or I may say, hey, I've done all the tests in the world. This is really because your dog died, or whatever the case may be. I'm going to send you to Ms. Burks, and she's going to work it out for you.
Right. More of a two-parter for you both. And this is probably more of a generic question. Part one is probably more of a generic question. When we talk about medicinal solutions to mental health, what are some of the more common medications available? Just to get some names out there, that's part one. And then part two, when we talk about medicine, we obviously need to talk about the possibility of addiction. What is the
Absolutely,
addiction potential of medicine?
absolutely,
And what are the major side effects of commonly used
absolutely.
medications?
So I'll take this one. So when we say medicinal is really a kind of a layman's term, because when people say medicinal, a lot of times people think about that herb that some of us, not me, enjoy on a regular basis. So really, we were talking about like pharmacotherapy. So pharmacotherapy, like there's a class of medicine called the selective serotonin reuptake inhibitors. Remember we talked about serotonin earlier in the conversation? That's one of our happy hormones, but after our brain releases it, it quickly breaks it down. So this class of medicine prohibits your brain from breaking it down, so you have more of that happy hormone left in your brain. So one of the first SSRI, selective serotonin reuptake inhibitors on the market, was Prozac. So people may realize, hear that name, Prozac, Zoloft, and these medicines work slowly over time. So they don't make you euphoric really fast. They don't bring up those levels. It takes about 3 weeks before they become therapeutic. And because they work slowly, the addictive potential of this class of medicine is next to nothing. Nobody's ever selling Prozac or Zoloft on the street. It's just, that doesn't make you feel euphoric. It's a long-term medicine, okay? Now, that's one of the major classes for depression. The major class for anxiety are the benzodiazepines. And now that's Xanax, or the street term is bars, or and I have to know this, y'all, because they make us learn it in school. So so bars or Xanax, and then Ativan is a class of medicine. And these benzodiazepines, remember, they treat anxiety, and anxiety is when you feel you're having that panic attack, that fight or flight. So they do two things. They calm you down and make you feel good and relaxed, but they do it instantaneously. So when you do it instantaneously, when you get that surge instantly, your brain says, you know what, we like that right there. We like that, and we may want more of that. So long-term use or even short-term use of Xanax can lead to dependence and then later on addiction. So there's a difference between dependence and addiction. So dependence is when there's a physiologic or a psychologic need. Addiction is where that need turns into, it disrupts your life. So we, a lot of times in medicine, are legal drug dealers, unfortunately. Like I have a patient, or I had a patient many moons ago, who unfortunately, and this is when I say many moons ago, like I've been in the game like 20 years, so this is early in my career, who unfortunately saw her sibling, her brother kill her father, and the reason her brother killed her father is because her father was trying to kill her mother. And her brother was an adolescent at the time, or adolescent/teenager, but a state that wasn't so kind to him put him in jail as an adult, and he's still in jail as of now. I mean, the last time I heard this was many moons ago. Well, she replayed that scenario in her head over and over again, and the only thing that really calmed her down was Xanax. Xanax is highly addictive, but everything else did not work. Her life was disrupted because of it. So in that controlled environment, she has a dependence, because that's the nature of that medicine. But was she knocking on my window talking about, Dr. Perry, what's up on that Xanax? No, she wouldn't do anything like that. She wouldn't do anything maladaptive. So that's the difference between addiction and dependence, right? Is there a maladaptive portion to that? Now, when we treat things, we have to look at what's the risk benefit ratio? Is this a situation where someone really, they are going through probably what I'm about to go through, empty nester, because my daughter just graduated from high school and I only got one, and she's off to the illustrious, the wonderful Prairie View A&M University, right? So in this case, I would be like, Rhonda, help a sister out, talk me through this, let's see what's going on, right? I wouldn't necessarily prescribe any medicines, but in other situations, medicine is most certainly needed.
Excellent content here. Rhonda, question for you. There are some people out there who ask what treatments are available, when dealing with mental health issues. But what some don't know is that there are multiple ways to support mental health without medication. Can you go into the detail with that? And Tamika, I'd love to hear your thoughts as well.
Sure. So when dealing with mental health, there are both pharmacological as well as non-pharmacological approaches available. And so some non-pharmacological approaches, again, are just psychotherapy. When a individual works with a trained therapist just to kind of explore and address the mental health concerns. It also helps clients develop coping skills, which can help them improve emotional regulation. And it also can help them gain insight into their thoughts and their feelings and just the behaviors that comes along with having anxiety or depression. There's also support groups out there, which provide opportunities for them to be able to just connect with others who are experiencing those similar challenges that they're experiencing. And it also helps offer peer support. It offers validation for them because sometimes you need that when you're going through those type of challenges. And it just offers a sense of belonging. Sometimes when you're having depression, you tend to kind of isolate yourself from others. And so this kind of helps reduce that feeling of isolation because you're surrounding yourself with a community of individuals that kind of are going through those similar situations. So those are some different things that you can do. Those are some different available options for dealing with mental health and without medication.
I think a lot of time, one of the things I ask people all the time is, do you have a support system? Who is your support system?
Mhm.
And, and to make sure that support system is always in a positive light, right? Do you have friends? I mean, as small as that sounds, we were not meant to be in this world and by ourselves in a small vacuum. We were meant to interact with people. Do you go to church? What is your faith? Do you feel comfortable at church speaking with somebody? And I think that's really a typical place where I start. And if the patient says, I do have a support system, but I don't want everybody to know. And some things you just don't want to leave to that support system because you want someone who's trained like LaRonda. So I always recommend it two-part therapy. One part is always counseling, always. Depending on the severity of what we're dealing with, that second part may include pharmacotherapy. Or I always leave the door open and say, we're not going to start medicine now. Let's do counseling. Let me get your counselor's notes. And when you circle back, we're going to revisit this and see if it's something that we need to do.
This one may come across to some on the call as condescending, but again, QTNA, questions that need answers, primarily because so many people just don't know. How
Right.
can someone know for sure if treatment is working? What are some telltale signs? And I don't mean immediate signs. I mean more of the long-term answers in this situation.
So it really depends on which entity we're treating. So let's say we haven't talked about, if I were to talk briefly about like PTSD, post-traumatic stress disorder, which the old term for it is shell shock. Damon and I come from a community and our families are really intertwined in the military. So we know this term shell shock, where you have a traumatic event and then that traumatic event is stored in your psyche and it's replayed over and over again every time something reminds you of that traumatic event. Right. So a long time ago in my career, I had a patient who was just walking along on the sidewalk and a car came up on the sidewalk and hit her and she was hurt bad. So for long periods of time, she couldn't walk on sidewalks that were in busy streets. I mean, it had to be virtually no cars on the road. That's PTSD. So we want to know, like, do your episodes of replaying that traumatic event go down? If you're depressed, that feeling of anhedonia, not feeling like you want to do anything? If you used to go to the movies every Friday, then you became depressed and you was like, I don't want to do it. I'm not going to the movies. And now all of a sudden you're like, well, maybe I'll go see the matinee. The most important that I've learned anecdotally is I always ask, can your partner come? Can your mom, whoever your homegirl, whoever's around you most of the time. And I always ask if you don't mind them coming into the room, do you think it's working? And a lot of times they'll be like, because sometimes the patients will be like, I don't think I'm any better. And their family will say, oh, they're so much better. She comes out of her room now.
Right.
Do you know what I mean? It's a good indicator. Once again, we're not meant to be in this world in a little vacuum by ourselves.
I agree with everything that Dr. Perry just said. I think one of the primary indicators is the reduction in the severity and frequency of the symptoms that's associated with the mental health condition.
Well, ladies, let's shift gears to psychotherapy, basically talk therapy. Having a professional discuss your issues with you. When is it time to see a professional, and I know this is probably going to be more, depends on the person, but I would love to hear it from you as the professionals. When is it time to see a professional, and what should someone look for in a professional when they're on the prowl or on the lookout? I'm sorry.
I can tell you, it's time as soon as the diagnosis is made. In this realm, Rhonda's job is more important than mine. So as soon as the diagnosis is made, that's when it's time. I promise I'm not biased here. This is what's honest and this is what's true. Rhonda, what would you?
I definitely agree with that. And if someone hasn't gotten a diagnosis yet, when you start experiencing just persistent feelings of sadness or anxiety or anger or feeling, really hopeless, I think that it's time to seek treatment. Also, if you see yourself struggling to cope with just life stressors, any type of transitions in life, if you're continuing to struggle with different traumas and grief and other challenges in life, then that's an indicator that it is time to seek therapy. Or if you just continue to see those unhealthy patterns and behaviors, then it's definitely time to seek therapy. I think one thing, some things that you actually look for when you're seeking a therapist, how do you know if this person is a good fit for me, which is really important. So you want to look, first of all, look for someone who is licensed, someone who is experienced, and someone who's trained in treating your specific a condition or concern. And you also want to consider what therapeutic approach do they take? How do they go about their therapy practice? What does it align with your preference or your treatment goals that you have for yourself? And another important thing is you want to make sure that you pay attention to like the location. Where are they located? Am I going to be able to get to them? Or what are their scheduling their scheduling like? Or is it flexible? What is their payment options? So all of those are really important factors when you're trying to seek a counselor or a therapist. And you want to make sure that you read reviews and ask for recommendations from friends and loved ones and family members.
And too, I've learned this just anecdotally, me going to therapists myself and working with a plethora of therapists throughout my career, is that cultural competence does, or cultural identification does make a difference. So a lot of times, in providers, we try to seek out providers who have something in common with us so they can identify. Right, they can identify what's going on. If I tell them that we eat salmon cakes with syrup at home, they know exactly what I'm talking about. If I tell them that my kitchen is turning gray, they know I mean the back of my neck, and I don't mean like my kitchen over here, right? So because this does make a difference, it does make a difference overall. So not only everything that was just said, it does make a difference. Now, it was a couple of comments in the chat. One I want to start. The first one I'd like to, if you don't mind, Damon, is Mr. Harper. Recognize him. Thank you for making that comment. He was talking about his dismissiveness, and his delayed his diagnosis and treatment. And this is, I think, innately us in our community, that's a natural inclination, is to dismiss these diagnoses. And thank you for pointing that out. Most certainly, if you think there's something wrong, there is.
Yeah.
Go and talk to anybody. And secondly, I think there was another question about any type of financial aid for counseling. Many of churches actually train people not only spiritually but secularly for counseling. I know it sounds like an oxymoron, but they train to recognize certain disorders. And so you can get free counseling at church. There are organizations, nonprofits that have free counseling. I could probably send some to Damon afterwards so that he can send it out to everyone. LaRonda, can you talk
Say that
about
again? I'm sorry. Someone was at my door. I'm sorry.
Oh, that's okay. We were talking about the financial aspect of counseling. Like, is there financial aid or free counseling services? And there are nonprofits that'll do it for free. There's some of my counselors that I use will put patients on a sliding scale based on their income. So where there's a will, there's definitely a way.
Most definitely. And I was just about to speak on the sliding scale because, you can see a counselor or a therapist who will put you on a sliding scale, and it is based on your income. So that is one way to see a therapist if you're having financial difficulties.
You know, and also people's employers, major employers will have a program called the EAP, the Employee Assistance Program. And professionals like LaRonda are contracted with them, and you get, that's part of your, you know, your benefit package when you work at that job. So if you're having an issue confidentially, you can speak to a, you know, 10, I think United Healthcare or Optum, who I ultimately work for, gives us like 20 or 30 sessions a year.
This is excellent
Cost.
content.
Yeah, no cost.
This is excellent content, and let me just segue into what you were doing. I know you were answering some of the questions in the chat, and I appreciate that. If anyone has any additional questions, please keep those, add those to the chat. We will get to those in about 5 minutes or so. I do have a couple of more questions for you, ladies. One of them, obviously, when we're talking about treatments, we have to talk about the safety of children. You know, that often comes into play. What can you say, and Rhonda, let me get you first. What can you say, since you are, you know, you work with children, what can you say either supporting or going against the treatment options for children? You know, there's a lot of people who have their thoughts about giving children medicinal options, things of that nature. What can you say, you know, either supporting or going against the treatments?
So I think in supporting treatments, I would definitely have to say that evidence-based practices are good because they're researched and they're proven effective in children's mental health. And it can actually provide a safe and effective way to just address the needs of the children. Also, I'm in support of just collaboration with between all healthcare professionals, like, you know, a child's pediatrician, their psychologist, or their psychiatrist, or even their therapist. I think this just ensures a comprehensive care, and it also safeguards the child's well-being. And then, of course, keeping the parents in the loop of everything is best practice to ensure that the child's well-being is being prioritized. One of the things that I'm really against is just over-medicating children. There's due to the potential long-term effects on the brain development and the behaviors, I'm just against over-medicating children.
So we have to really look at like what is the pathology, and if we talk about like depression in general, some of the SSRIs in adolescents will actually increase the studies of suicidal ideation. So we have to use this very, 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 very carefully. Like if we have a child who has severe depression with psychosis, that's something different. And psychosis is basically when you're seeing and hearing things that other people don't see or hear. So we don't want you to hurt yourself or anyone else. So we might want to consider medication at that point. But for run-of-the-mill mild to moderate depression without psychosis, like LaRonda said, that's not necessarily an indication for it. So we need to talk about what exactly, which disorder we're trying to treat. There was another gentleman in the chat who said, you know, if you bring it back culturally, he said, I appreciate seeing, you know, professionals who look like me because it makes it easier to relate to. And I'm gonna say this, and this is probably another topic. Thought I heard my daughter coming out. That was going to be a CPS situation. So, so this is probably another a topic, but that is important, y'all. We as people of color in healthcare don't get treated the same. You know, equity or equality is not the same in health. We are oftentimes denied medications we need. We're given medications we don't need. We are given less CPR. So anytime, and I can go on and on, the maternal fetal rate is higher than us, regardless of our socioeconomic status. So you could be Michelle Obama. The chances of your baby dying in the hospital is still super duper high in comparison to Michelle Obama's white counterpart. In fact, in comparison to Michelle Obama's white counterpart who lives under a bridge. So it doesn't matter. It's just the actual race itself. So anytime you're talking about treating children or yourself, don't be afraid to ask questions. You are entitled to equitable health. We are entitled to equitable health. We are entitled to, at the very least, the standard of care. So if a provider gets upset because you're asking questions, that provider is not for you. Now, I'm not saying be like, oh, what that is, but no, if you're asking questions, like, well, can you tell me the mechanism of action of that drug? How long does it work? What does the study say? You know, how many therapy sessions should I be going to a week? No, that's what you're entitled to ask. You know, when I go take my fancy car to the fancy place, how dare them not let me ask a question about it? because I'm paying for a service. That applies to when you come and see me and LaRonda also. You're entitled to ask questions.
Right on, right on. My final question for you, and then we'll go to the Q&A. If you feel someone is in need of treatment or even in need of a diagnosis, what are some strategies for supporting someone experiencing symptoms, and how should they be addressed in treatment?
So, again, the symptoms are multifactorial. And if it's someone that you know and love, you know how to approach them and you know what to say. But one of the things you could say is, I have noticed that you are, and whatever acting differently is, let's make sure it's not something medical, right? Let's see your doctor. And that usually opens the door. And once they get into their competent provider, that provider usually can tease out of what's going on. I know how to tease out the difference between hypothyroidism, thyroid disorder, and just depression because of what's happening in life.
Ronnie, you care to add?
No, everything she said, I agree with, yes.
All right, good deal, good deal. Well, ladies, this has been extremely informative, and I'm so glad both of you just took the time out of your schedules to chat with us. Before we go into Q&A, let's make sure that we have a way to contact you. If there's any questions, maybe they want to work with you. What's the best way to reach you? Rhonda, we'll start with you. And I'll put your information in the chat if you don't mind.
Yes, so I'm on Psychology Today under Seasons of Life Counseling. I can also be reached by calling me at 214-377-0216. You can also email me at seasonsoflifecounseling318@gmail.com.
So you can probably Google me and find me anywhere. The bad Google stuff, just pretend that haters gonna hate. And I'm just playing. There's nothing bad out there. But you can you can Google me and you'll see my office number, but it's 972-942-7700. If you would like to be a patient, they're gonna tell you Dr. Perry is not taking new patients. You tell them that Dr. Perry said I was on the chat with the brothers, the blue and white brothers, our mighty Sigmas, and she said yes. Okay. And I'll know exactly what you're talking about because they will walk back to my office and tell me that. Yeah.
Make sure that they give a password of something like Hershey or Kirby or
I know,
something like
right?
that.
Wichita Falls.
Yeah,
You know what I mean?
All right. Well, let's get to some Q&A. And you answered a couple of the questions that's already in the chat. So I appreciate you for doing that. There's a question here from Renetta Williams. I know her very well. You may or may not know her too, Tamika. Would some research suggest that 6 to 10% of all police contacts with the public involve people with serious mental illnesses? What can policing do to improve how these cases are handled?
Well, one of the things that you're talking about police itself, I think they need better training, right? Better training to recognize that this is a person who has a mental illness. LaRonda and I, when we are, out and about in the public and we see certain people, it is our nature to go paranoid schizophrenic, clinical depression, anxiety, even, my sister and I are physicians and, and my family hates for us to go places because, we look at people and we can tell certain physical or body mannerisms and give diagnosis, not just even mental diagnosis. But cops need to be one of those people who learn to recognize this is not a, situation of a man who is super duper violent. This is a man who's going through a psychosis, and I need to handle that appropriately. So the training of our police officers, basically.
Rhonda, you care to comment?
Not at this time.
Okay. There's a question from Neil. I think this was covered, but I want to see if we can go a little bit more into detail on that. Is there any financial assistance in therapy or covered by insurance?
So it is covered by insurance. LaRonda's on several plans that, we appreciate her for, and it is covered by, commercial insurance. It's covered by Medicare, and to a lesser degree, it is covered by Medicaid. In addition to that, there are organizations that will give free counseling sessions. You can get on a sliding scale for counseling sessions, and most of everybody on the call today likely has, and I know quite a few people work for a bigger organization, and that bigger organization usually built into your benefits package is something called EAP, in which you can get so many free counseling sessions, and it's going to be individual like LaRonda who's contracted with them.
Rhonda, you care to add?
Just to make sure that you are taking advantage of your EAP through your employer, because that is a benefit that is factored into your benefits, and so it is free to you, and you have so many sessions. It just really depends on your employer how many you get, but you definitely can reach out to the benefits department to get further guidance on that.
Okay. Charles Harper asks, how do you best support a loved one that needs mental health support?
That's a great question. It's a hard question too. But, first you want to encourage them to seek out help, and really support is the key. And support, you're the loved one. So support them when they go to the physician, support them, ask, can they come to the counseling with them? Help them realize that this is a medical diagnosis, and it's not just there's something innately wrong with you. You're not, a lot of my patients like to say, well, you don't think I'm crazy, do you? I don't want to take no crazy pills. Well, crazy is a derogatory term that LaRonda and I do not like to use. That is not what we're talking about by any shape, form, or fashion. We want you to get treatment for something that affects your everyday life.
I think it's important to show support too, just by being understanding. And again, like I said earlier, just educating yourself on mental health so that you can, help them to be able to get the resources that they need to seek help. And also like Dr. Perry said, just being available to kind of support them and going with them to different appointments and helping them find the appropriate resources.
All right. And I wanted to throw one out when we kind of towed the line with this one, but I want to make sure that it is answered. If treatment suggestions fail, what are some options or potential ideas for an individual looking to cope with their well-being?
That's a great question. So it really depends on which entity we're trying to treat. But if I give a blanket answer, treatment options can go beyond just outpatient therapy and medications. You can do intensive outpatient therapy. Basically, you're going to a facility every single day where there's an individual group setting and having psychotherapy. Rhonda may be your moderator in a situation like that. You could do a partial hospitalization, or you can be hospitalized for mental disorders, just like you can for, an exacerbation of your blood pressure or diabetes.
And if you want to take a lesser approach, if all of that also fails as well, if you want to take a lesser approach, there are other ways you can, other options that are available, if you taking more control of your own mental health, just by doing like meditation. I know that sounds simple, but things like that actually does help reduce stress and increase your self-awareness. Getting more engaged in like physical activities, changing your health style, your health, changing to healthier lifestyle choices, and just diving into those things that you really enjoy doing on a day-to-day basis. Those things may sound simple, but they really, really do help in reducing depression and anxiety.
And let me just, Rhonda made me think to touch on something. We were talking about medications earlier. So, medications get a bad rap, in which a lot of times they should. I don't work for any pharmaceutical company, nor do I get paid from any. So that is not my nature. My nature is to keep my patients healthy by any means necessary. But let me just put it out there like this. Everything on earth is a chemical, including water. It's two hydrogens bound to an oxygen. So I say that everything is a chemical, meaning that there are some natural, and let me just digress a little further. The chemicals that were made in the labs that we call drugs and we sell, we steal their structures directly from plants. Like, we steal from nature and we sell it to the general population, or the pharmaceutical industry does, right? So things like valerian root that you can buy over the counter, valerian root has some similar, not as potent properties as benzodiazepines, but it's natural. They capsule it up and it does help calm you down. It does help relax you. Chamomile helps relax you. So there are other options you can go to say, hey, I don't want a prescription drug. I just, need something to help calm me down. Maybe you need a little valerian root with ashwagandha.
Got a two-parter here in the chat. One involves the elderly and the other involves children. When we talk about the mental health treatment for the elderly, let's get your generic thoughts on just, your take on that, whether it's going in the positive, whether it needs improvement, things of that nature. And then the second part, when we're talking about children, what effect have you seen in children, particularly during the COVID era, the COVID pandemic?
Okay, so I'll take the elderly
Okay.
comment first, and I'll let LaRonda speak on the kids. And mainly because I stopped treating children a long time ago, my career just shifted in a different direction. But the elderly, the number one, what's called comorbid condition or diagnosis of the 60+ population is depression, the number one diagnosis. And you got to think about people's lives change. And we identify ourselves with a role in life. What is my role? My role is, mother, my role is physician, my role is, side businesswoman, hustle, whatever my role is, right? But at some point in your life, that role changes. So the senior population, they're longtime empty nesters, their neighbors started to pass away, their spouse may have passed away, and now you have depression. So that really has to be addressed and it has to be recognized. And a lot of times you have these hardcore baby boomers plus say, I don't know depression. But once again, they're crying the whole scream, or they're teary-eyed, or they're looking down the whole time. Now, going back to people who are not meant to be in a vacuum, that's why things like senior centers are important, because people who are in the same situation come together, and guess what? In life, they find their new tribe, and that new tribe brings them a new sense of well-being and purpose. So one, we need to recognize it. Two, we've come a long ways in antidepressants and anti-anxiety medicines. So even though we talked about some pretty potentially horrific side effects, they are much safer than they were in yesteryear, and they do a lot of my seniors a whole lot of good. So we're making strides. We're getting there, but we definitely got a ways to go.
So just real briefly, I just think that children in general, have been experiencing a lot of mental health challenges, specifically since COVID. Like you've just seen an increase in anxieties specifically, and just fear of things happening around them. They've been socially isolated a lot, and so that causes a lot of challenges within itself. You saw a lot of disruption and just, their day-to-day routine. So in order to just kind of, combat that as parents and guardians, we just have to be attentive to the mental health needs that has arisen since post-COVID, the needs of the children, and just be able to just kind of provide the appropriate support and the resources and interventions that they need in order to kind of just navigate all the different challenges that they're kind of facing since COVID.
The biggest need is to a lot of that mental disorder that happened, or like the mental anguish that happened during COVID was isolation. It
Yeah.
was isolation, because we are not meant to be by ourselves again.
This is excellent. This is outstanding dialogue, and I appreciate your time, ladies. I have one final question for you. This may be the most important question of the night. Dr. Perry, you mentioned that you ate salmon cakes with syrup. And I
Yes.
believe that was in the
Yes.
chat. Somebody
Yes.
questioned.
Yes.
We would love to get your thoughts on that, please.
It is tasty and delicious. And if you'd like me to make some at the housewarming party, let me know. And if we don't, I prefer molasses with it. However, if I don't have that, then I have syrup. It is tasty and delicious. Those are my thoughts.
I will bring the syrup. You just let me know what
Okay.
kind. I will bring the syrup.
All right.
Done deal. Done deal. All right. Well, listen, for everybody, that's going to conclude this Mental Health Power Hour seminar. Again, I just want to thank you, Rhonda. Thank you, Tamika, for coming on. Before I go, I would love for my chapter president, Brother Eric Hill, to provide final thoughts. I know he's on the call here. And Eric, the floor is yours, my brother. Let's make sure he's
Yes. Good evening, As Brother Sales mentioned, my name is Eric Hill. I am the president of Omicron Sigma chapter of Phi Beta Sigma. And again, this is our second installment of a series of 3, and it just keeps growing. And so I am pleased that we are getting the word out and getting the messaging out so that we can help our communities identify and treat the mental illness and erase the stigma that is associated with mental illness. So thank you to our panelists. We definitely appreciate you. We look forward to possibly doing some things in the future as we continue to, to change the narrative and get our people educated. So thank you.
Well, thank you.
Thank you.
Absolutely, absolutely. Well, everybody, thank you for coming on once again. Last week we talked knowledge and signs. Today we talked with our lovely panelists, our Delta sisters. We talked about treatment and diagnosis. Next week, we're going to talk about the improvement of well-being. So we'd love to have you all come on. Dr. Rhonda, we'd love to have you both be a part of that and just listen and just take in the knowledge, and feel free to come on our chat and have questions. But for now, thank you very much. We appreciate you all. And for everybody else, you have a wonderful evening. Good night, everybody.
Good night.